Hello everyone, my name is Gracie Carr and I am going to talk to you today about a serious heart condition. First, let's start with a little backstory. At 40 years old, Jane was a busy mom with a high-stress job. She is constantly on the go, balancing her personal life, kids' activities, home life, exercise, and her work. She knew she was growing increasingly fatigued, but this feeling of exhaustion seemed like her normal nowadays. However, the fatigue slowly grew into more physical symptoms, such as feeling mildly short of breath while running around doing errands and while exercising. Jane was out for her daily walk. She has always been a very active lady, as this was a stress reliever for her in her busy life, and she tries her best to stay healthy. During her routine walk, she felt that shortness of breath that she had been experiencing more and more lately, but this time accompanied by chest pain, a rapid heartbeat, and dizziness, which ultimately all led up to her fainting. These symptoms would lead Jane to a significant medical diagnosis, cardiomyopathy. Welcome to my TED Talk. You might be wondering, what is cardiomyopathy? Cardiomyopathy is a disease of the heart muscle. According to UpToDate, this myocardial disorder is characterized by the heart muscle being structurally and functionally abnormal and can be due to unknown cause. In a normal, healthy heart, systole and diastole of the myocardium efficiently pump blood to the body, and the muscles can function to adapt the rate and rhythm from electrical signals based on the oxygen needs and demands of the body. In cardiomyopathy, the heart muscle abnormalities cause electrical and mechanical dysfunction due to thickened, stiffened, or enlarged heart muscles. These factors impact the heart's ability to pump blood efficiently and lead to a variety of symptoms. In clinical practice, cardiomyopathy has been applied to being an effect of hypertension or heart disease. This leads us into the various pathogenicities of cardiomyopathy. There are multiple types of cardiomyopathy that we will discuss today, including dilated, hypertrophic, restrictive, and arrhythmogenic right ventricular cardiomyopathy, or ARVC. Dilated cardiomyopathy is the most common type, and it results from the thinning and stretching of heart chambers and starts in the left ventricle. The left ventricle is the main pumping chamber of the heart, therefore telling us that this will affect blood being pumped to the rest of the body. A risk factor for dilated cardiomyopathy is heart conditions such as coronary artery disease, past heart attacks, and genetics. This type decreases output from impaired systolic function. Hypertrophic cardiomyopathy is a thickening of the heart muscle, making the heart work harder to pump blood adequately. The thickened areas can block the ventricles of the heart, and this can lead to obstruction of flow of blood due to impaired diastolic filling. This type can start at any age and is commonly linked with family history of the disease. Scientists have estimated that only 1 in 5 people with hypertrophic cardiomyopathy get diagnosed, and this is due to absence of symptoms and blood flow being unaffected by the thickening. Oftentimes, they are diagnosed when they are being screened for other health conditions or heart disease. Restrictive cardiomyopathy is a rare type of cardiomyopathy and is associated with stiffening of the heart muscle, therefore the heart not being as flexible and lacking appropriate normal expansion. The ventricles of the heart are unable to relax and therefore don't fill with adequate amount of blood to pump out to the body. This leads to poor stroke volume. This can be caused by other present disease or for no known reason. ARVC is a rare type of cardiomyopathy that typically occurs between ages 10 and 50. Like its name, the right heart chamber and ventricle is most affected and replaced by fatty tissue and scar tissue, which can disrupt electrical signals, causing an irregular heartbeat or arrhythmia. This is a genetic disorder and can lead to sudden cardiac death from these life-threatening arrhythmias. While the various types of cardiomyopathy are dependent upon how specifically affect the heart's structure and function, as well as how they are caused, all of the types have the same thing in common. They weaken the heart muscle. A common misconception about cardiomyopathy is that it is the same as heart failure. However, while both conditions affect the heart's functioning of pumping blood, Cardiomyopathy is specifically associated with dysfunction of the muscles, whereas heart failure can be associated with many heart complications, such as rhythm disorders, valvular disease, and more. The overall prevalence of cardiomyopathy is seen globally and can affect all ages, both males and females, and races, although studies have shown African Americans are at an increased risk of nearly 3 times higher than white people of dilated cardiomyopathy. Risk factors for cardiomyopathy include genetics or family history of the disease, cardiovascular diseases such as hypertension or ischemic heart disease, past heart attacks, obesity, long-term alcohol use, pregnancy, and extreme high stress. To assess for cardiomyopathy in patients, it is vital to gather family history to assess for risk of cardiovascular diseases, as well as evaluate other risk factors, such as personal past medical history questions regarding hypertension, previous heart attacks, and current symptoms. Clinical manifestations of cardiomyopathy can range in severity and include fatigue, shortness of breath with activity or rest, chest pain, heart palpitations, rapid heart rate, peripheral edema, bloating, dizziness, and fainting. Additional physical exam findings include potential murmurs upon auscultation, arrhythmias, edema, and jugular vein distension. According to the National Heart, Lung, and Blood Institute, diagnostic tests such as imaging and labs are pertinent to aid in diagnosis. Echocardiograms depict the heart size and shape and how well it's functioning. A stress test is another diagnostic measure that assesses how the heart works under stress and how blood flow is affected, such as during exercise. In addition, lab work such as BNP and troponins to assess for indications of heart failure is essential. In some cases, genetic testing can be done to assess for certain inherited types of cardiomyopathy upon a family member being diagnosed. It is essential to promptly diagnose cardiomyopathy if suspected, as it can lead to other serious and dangerous medical conditions, such as heart failure, blood clots, heart valve issues, and even cardiac arrest and sudden death. To lower your risk of cardiomyopathy, taking the appropriate steps, such as avoiding alcohol, eating a healthy, balanced diet, exercising regularly, lowering stress, keeping up to date on vaccinations to lower risk of infection, and controlling medical conditions such as hypertension and high cholesterol are initial heart-healthy practices. According to UpToDate, the primary goals in treatment and management of cardiomyopathy is to improve quality of life, prolong survival, and reduce risks of acute cardiac diseases and issues. Pharmacological management involves medications such as beta blockers, calcium channel blockers, diuretics, digoxin, and others to treat effects and symptoms. Other treatment options include surgically implanted cardiac devices or heart surgery if indicated. Treatment depends on the type and the associated effects and complications associated with it. Following Jane's diagnosis, she worked alongside her cardiologist to develop a plan for her life and well-being, living with cardiomyopathy. Through pacing her exercise routine in shorter amounts, beginning pharmacological therapy, following a low-sodium diet, heart-healthy diet, and finding new mechanisms for relaxation and stress relief, she's been feeling healthier than ever. In conclusion, cardiomyopathy is a very serious cardiovascular condition that oftentimes presents itself slowly and silently and can lead to many complications. However, people with cardiomyopathy can live long, healthy lives through proper lifestyle changes, treatment adherence, and care through cardiovascular medical team. That is why it is vital to be aware of symptoms and family history to recognize risks early and seek prompt evaluation. 2, provide proper patient education on medication and non-pharmacological management to improve long-term outcomes and improve quality of life. And 3, understand that treatment risks and complications are associated with multiple varying types of cardiomyopathy. Individuals working to maintain a heart-healthy lifestyle is at the basis of prevention. Thank you so much for listening to my TED Talk. Here are my references listed.